Local doctors in for everyday solutions. This week, Dr. Z is going to talk about psychological testing for ADHD and autism. So, Dr. Z, what is the psychological testing or assessment for this?
Good morning, Cynthia. Good to see you. And again, this is no relation to the previous segment with Stephanopoulos. This psychological testing it's like taking a psychological X-ray, and it helps psychologists and medical providers understand how people think, how they process information, and in ways that may affect their behaviors. It also helps get an accurate diagnosis, understand treatment, and may impact the need for accommodations at school and at work.
Okay, so what is ADHD for those who don't know what it is? And how do you know if you have it or if you suspect someone has it?
Well, ADHD usually has to do with attention deficit and hyperactivity. So we're talking about difficulty focusing, completing tasks, and like that. As opposed to autism, which is difficulty reading social cues and sometimes a hard time bonding, leaving those people kind of disconnected.
Okay, so if someone suspects that they may be experiencing this, or if you are a parent and you see that maybe your child, so what should they do?
Well, our team believes that testing is really the responsible approach to this. And so it usually begins with a visit to a psychologist who determines if testing is appropriate. And the testing takes a few hours. It can happen over 1 to 2 days in a relaxed, comfortable office where the person does standardized tests, does puzzles, answers questions.
And so let's say that they are diagnosed with ADHD or autism. What should they do? What are the recommendations as far as medication?
Well, it really depends on severity, and treatment for autism and ADHD are different. But the common medical treatment these days has been a form of stimulant, something like Adderall or Ritalin. There's newer medicines coming out all the time. But the problem is that I've just seen too many, especially children, go in for a brief visit, have some difficulty in school, go in for a brief medical visit, and come out with a powerful stimulant that pushes the blood pressure, pushes the heart rate, and really isn't great.
So there is a risk then possibly for the stimulant?
Well, there can be a risk, but we also are looking at the risk of actual substance abuse. So we're seeing professionals, students coming in asking for these powerful stimulants just so they can work more quickly or for longer, and that doesn't end well. So for that reason, an accurate diagnosis and testing is the best approach.
Thank you very much, Dr. Z. And we will, of course, have all this information on our website.